Let's head overseas now, and the eastern states of Australia are on tenterhooks as Victoria recorded its highest daily number of infections since the start of the Covid-19 outbreak. There were a record 484 new cases overnight and 2 more deaths, bringing Victoria's death toll to 44, with the nationwide toll at 128. And despite the continual surge in cases, Premier Daniel Andrews has denied reports the state could enter into a New Zealand-style lockdown. Alex Perrottet has more.
Controls Australians are trying novel ways to travel north. This man was found by police in a car boot on the Queensland border with New South Wales.
Well, hello, buddy.
Hello.
Why are you trying to sneak across, mate?
The reason is pretty clear, with Queensland Premier Anastasia Palaszczuk boasting today of only 3 active cases of Covid-19 in the Sunshine State. But the picture isn't so perfect as that. Police are also hunting for 185 people who are missing from self-quarantine after giving the wrong contact information to police at the Queensland border. There's another 25 who weren't at their homes when police came knocking. But further south, the temperature is rising and state leaders are sounding rattled. Gladys Berejiklian in New South Wales announced 16 new cases today and, concerned about the growing clusters, turned up the heat with her threats. New restrictions on gatherings and bookings at pubs, cafes and restaurants will come into force on Friday, and she wants flouters fined.
The state is on high alert. Please, we want everybody to think seriously about what they're doing over the weekend to make sure you avoid crowds. My conversations with the police commissioner and with the regulators is please make sure you throw the book at anybody not doing the right thing. Everybody's had ample notice.
And the Police Commissioner Mick Fuller is again battling protest groups in court over whether they can march next week in Sydney in a Black Lives Matter march.
Do you want your protest to be the one that puts New South Wales back 5 or 10 years economically? Because that's exactly what could happen. It's exactly what we saw in Victoria. The message to my police out there is that we've given plenty of warnings. People fully understand the risks out there. The warnings are over. And if 1,000 people turn up, maybe I can only write tickets to 500. But do you want to be the first person to get the $1,000 ticket? That's the question.
Mick Fuller alluding to the cluster at the state housing towers in Victoria, some of whom were linked to a Black Lives Matter protest there. Now there's 205 Victorians in hospital, 40 of them in intensive care. The Premier of the Southern State, Daniel Andrews, was careful today with his tone, feeling the backlash from his own people for the blunder in letting that cluster fester with shonky security guards. The ABC reported this week that quarantine guards in Melbourne hotels were recruited via WhatsApp messages and told to bring their own masks. But there's no question that plenty of Victorians also have themselves to blame. Data released today shows that over the last 2 weeks, almost 90% of people infected still went to work and visited the shops after feeling unwell, and 53% of people who did get a test did not stay home before getting their results, despite the clear advice from health workers. But even that hasn't prompted Dan Andrews to consider a stricter lockdown.
We can't rule those measures out, but at this stage, the key factor here that's driving the numbers and driving our challenge is people that are sick but not getting tested. They ultimately do get tested, many of them, but in those intervening days, they are going about their business with symptoms at the height of their infectivity and giving it to others.
The Premier did threaten the current 6-week lockdown could go for much longer if the numbers don't come down, but he couldn't confirm if there were any penalties for people who don't follow the rules.
No one should be waiting for a test result at the supermarket or at their place of work or anywhere else other than their home.
But there's criticism that his hardship payment for people in insecure work doesn't reach people until they've tested positive, not when they're asked to stay at home awaiting the results. At the beginning of the month, there were 370 cases in Victoria. Now there are 3,408. And in the face of such numbers, health workers in Victoria are warning the other states to stay vigilant or face the same peril. For Checkpoint, Alex Perrottet.